Timothy Brown here. I'm the CEO of Roy Corporation, dental practice appraiser and broker. Some of you know me, some of you don't, but we appraise and sell practices in Canada. I'm here with Dr. Alan Leko on my left from AL Dental Consulting. He's a great dentist. We know each other for quite a few years. I've appraised and sold his practice. So we got something to share with you. We also have Rod here from Dental Rainmaker. I love that name, Rod, Dental Rainmaker. The goal of this is to tell you a little bit about what Alan and Rod are doing. I'm not involved financially, full disclosure. I'm not making any money off of this. I'm doing this because Dr. Alan Leko, you know your shit. Excuse me. You know your stuff. So Alan, tell us a little bit about what you're trying to do to help dentists, and then I'm going to ask you a few questions of Rod. Go ahead, Alan.
All right. So basically sold my practice back in July of 22 with you, obviously. Transitioned till the end of the year and took a year off just to kind of do some stuff, catch up on things that I haven't, because as we all know, as practice owners, we're super busy. So my whole goal is thinking back on everything that I've been through. I want to be there to be someone to support other dentists. I want to be a support network to them, and I want to help them to achieve their goals. And I want them to succeed like the way I did. And also make their lives easier, because as we all know, the dental profession is tough. It's demanding, and one of the things that I wish that I wanted to do better and to convey to other members of the profession is to get a good work-life balance, enjoy life, but also enjoy your dentistry. So I'm there to kind of merge those two things together and make it more enjoyable as well as more profitable.
Before we go over to Rod, I appraised Alan's practice, and whenever any company like mine in Canada, and there's a number of us, we ask a lot of questions. Give us your data, give us your stats, give us your reports. And Alan, when you supplied us with your opening salvo of dental practice reporting, stats, and data, I was quite frankly flabbergasted. You presented it to me in person at my office, and I went, holy jumping. I don't see stuff like this very often. You've got it broken down into, not by the minute, but certainly by the hour, by the productivity, procedures, like way more than what we normally get, which is usually from dental software. And Alan, I think you would agree with me that dental software is at best.
Well, it gives you the data, but I think from that data, you got to extrapolate what's actually going on. You have to see the trends that are going on in your own practice. You have to see, where you can improve, where things are going well. I mean, for me, I was looking at it on a daily basis, sometimes even on an hourly basis, looking at productivity, hygienists, looking at the dentist, looking at what the total hourly cost would be, looking at your profitability and seeing what you get at the end of the day and adding up those hours towards the end of the day and looking what your goal is. For me, I had a goal every single day, how much I would do in a week, how much I would do in a month, and how much I would do in a year. And I try to achieve those goals. And at the same time, while we were getting that profitability through our processes and our practices and our dental skills, I was also looking at ways to cut back. Ways to find savings, looking at your overhead costs, looking at the material costs, who you're dealing with, how you're dealing with it. So I think that is something that is really important and is pertinent to running the practice as a whole. You have to manage your practice. At the end of the day, you're the owner. And at the end of the day, you're the one who should be looking. You have everybody who's designated to do their stuff, but your name is on that door. And at the end of the day, you're responsible for everything, as well as, how the practice is going in the end, because everybody depends on you.
Well, I'm just going to compliment you one more time, and then we're going over to Rod, but, you did it well. You did it right. It was very impressive record keeping and reporting, far beyond what the average dental software can do, way beyond. Far more greater detail than any office manager could be asked to request, because you were a hands-on owner operator. And that was very impressive to the appraisal. It stimulated appraisal value. It stimulated sale price. It encouraged the accountant and the bank for the purchaser to go, this looks like a good business. This is the kind of stuff we want to dig our teeth into. So, you talked about AI earlier, and Rod, Dental Rainmaker, that's kind of your thing. Tell us about how we can take traditional dental software and the mindset of the typical dentist, and how do we automate it? How do we use intelligence?
Well, that's a great question, Tim. I mean, there's a lot of technology going on out there right now. It's being introduced in many different industries, and unfortunately, it has not been leveraged fully in the dental industry. And that's really what we want to do, basically integrate that and introduce that, and to leverage the technology. But more importantly, from a acquisition retention standpoint, I know some of the challenges that most dentists have is basically on those front. That's basically we'll be able to accumulate a lot of the teachings and the lessons and the things we've learned over the years in the dental practice space from a digital marketing standpoint. So like local SEO, pay-per-click ads, any lead generation things, and integrate AI into that, because that's really going to expedite the growth much quicker than normal standard digital marketing companies that they're doing right now. So
You know, Alan sees all this because he's on every mailing list. Alan, you're getting sales people, emails. I see a fair bit of it because I'm so close to the industry, but I'm having a little trouble navigating the language and the noise and the confusion about, you know, how all of this is going to unfold. You know, if you had to give, let's give the viewer a quick takeaway. I'll ask you first, Rod, then Alan. Rod, you know, what's the #1 tip you could give away for free right now to a dentist who's, you know, swarming in computer data with no understanding?
well, I think that question right there just kind of nails it on the head, because at the end of the day, you don't need to know all this stuff, right? You have people like myself that can really get into the weeds of it. And bottom line is it can be very complex, and for people like myself who needs to kind of be a part of it, that let me do all the heavy lifting, right? But in terms of what you need to do, obviously what you need to focus on is the brand, right? You need to stand out from the pack, because you don't want to be another Me Too company. You gotta have a good unique value proposition. And again, it's just the technology itself. It's a nice to have. It really expedite things and it sets you apart. But at the end of the day, if you don't have the proper branding and the proper positioning,
And the
unfortunately, you're
marketing,
not really going to get far, right?
digital marketing, AI, dental software, and then the brains. Alan, we have to speak again to, you know, dentists are intelligent people. You don't become a dentist without having a head on your shoulders. So, Alan, if you had to give the viewer a couple of prime tips in closing before we wrap this up, what would that be?
Well, I'm gonna piggyback off of Rod in terms of getting the people in terms of setting your brand, but that also takes place directly in the office. It's the patients. The patient is first. We need the patients. The patients are our lifeline. Without them, you can be the best dentist in the world, have the best staff. If they're not coming through the door and they're not staying at your practice, it's not going to be profitable and your business isn't going to do well. So for me, the biggest thing is the way that we treat our patients: friendly, a comfortable environment, very warm and inviting. The way that we treat our patients in the dental chair, huge. I'm a big proponent of patients being in control of their appointments. I think one of those things was huge, and from my interactions with patients, having them control their appointments, having them say when they need to take breaks, always asking them if they're okay, guiding them through procedures, helping them to understand what's going on, how it's going on, because as we all know, nobody likes going to the dentist. There's a huge fear and anxiety towards it. So if we're able to keep those and retain the patients that we're able to bring in through Rod's strategies with respect to digital marketing, and we combine those two together, I think it's a recipe for success.
Well, there you go. And I think that every dental practice in Canada is operating adequately. To be honest, the average operational standard, business-wise, not clinically, I don't speak to clinical standards. I think the average dental practice is adequately run. So there's so much room for upside in the average dental practice. And, you know, I think practitioners are getting a lot of information from a lot of sources. You just need to reach out. I've been Timothy Brown, CEO of Roy Corporation Canada's dental practice appraiser and broker, here with Dr. Alan Leko of AL Dental Consulting, and Rod from the Dental Rainmaker. I love that name. Thanks for watching, folks. We'll have some more episodes coming soon. Thanks for joining us.